Stephen Kappa. I'm really thrilled and honored to have you join me today to talk about this very important topic. So we'll just jump right in with the title, which is Men's Health, Understanding and Treating Urinary Problems and the Enlarged Prostate. So I want to talk about, again, obviously we're going to go into details about the prostate, what it is, how it works, what it leads to in terms of urinary problems and other health problems. But this is always a bigger topic. And when men come in to see me in my clinic, we always talk about the umbrella term of men's health and what that means. Your urinary function, your sexual function, but also your blood pressure, your cholesterol, your weight. There are a lot of things that impact your sexual and your urinary health. And so you'll see throughout this presentation how important that is. And you also see how it relates to very important topics like prostate cancer screening. Again, we're not going to go into details about that tonight, but as we evaluate the enlarged prostate, we also do prostate cancer screening for all of our patients. That's something we're really passionate here about at the urology group, and something that I'm really passionate about personally. And so we're going to hear about the prostate, but also more men's health themes that are really important to get you feeling well, peeing well, and having a good quality of life. So this is a little bit more about myself. So again, I'm Stephen Kappa. I'm originally from East Tennessee, so I am a transplant to Cincinnati. So I did my undergraduate studies at Yale University, then came back to my home state in Nashville, Tennessee, where I was at medical school there at Vanderbilt. Also did my business degree there. I'm very interested in health policy and business, and also did my urologic general surgery and my urologic surgery residency. So this great practice brought me here to Cincinnati, where I live with my wife and 3 children, and we absolutely love the community here. It's really a pleasure to take care of patients in our practice. So you'll see my specialties there. I'm going to focus in on the enlarged prostate and minimally invasive techniques, but we are happy to serve any of your urologic needs here in our practice. So jumping into the next slide here. So I like to start just with definitions. Some of you guys who are on this call or family members may be very familiar with BPH. You may have had an appointment or even had a treatment or been on medication, but let's just start with the definition. So BPH is the acronym. I'll use it a lot throughout this talk, but it means benign prostatic hyperplasia. It often refers to an enlarged prostate. Okay, so the important thing is it's not cancer. This is not prostate cancer. That's a really important topic. Obviously, it's the most common cancer in men. 1 in 8 men will get prostate cancer in a lifetime, but this is different. This is also very, very common. You can see 43 million men in the United States experience BPH and suffer from its consequences. It is, though, very treatable. And that's the thing I want to emphasize. If you have some of these symptoms that we're talking about tonight, do not hesitate to go to your primary care physician. Do not hesitate to make an appointment with one of us. These are very treatable conditions, and if ignored, you can result in some very serious consequences. So again, it's very common, but it's very treatable, okay? And why does it happen? I mean, there's a lot of explanations for this. We're not going to get into those details, but what I'll tell you is it's almost inevitable with age. So as you get older, your prostate will likely get bigger, and you'll likely experience some of these symptoms we're going to go through. So anatomy. So we start our medical school careers in the gross anatomy lab. It's actually a really special experience where you dissect a cadaver head to toe and you look at every single system. So we're focusing my career, and I focus on the urinary system. So you don't see all the parts of the urinary tract here. Up here in your back are your kidneys. Okay, so they sit back here and they filter your blood, waste products, turns into urine. The little tube called the ureter takes it down to the bladder. Now, the bladder you see here is a remarkable organ. So it's a pump, like the heart, it's a pump, but it is extremely elastic, actually. And what I like to think about is if you're at a movie that you really like, you don't want to miss the ending of the movie, or if you're at a Cincinnati Bengals football game and Joe Burrow's driving down the field, you don't want to miss that touchdown pass. You're going to hold your bladder, and again, your bladder has a remarkable capacity to hold a lot of urine, especially if you're drinking Coke, hopefully not a lot of them, or a couple of beers, hopefully not a lot of them. You're going to be really full of urine, okay? And so it can stretch really far. Now that's okay as an emergency, but you don't want to be in that condition long term. Again, it'll really damage your bladder. So you see the bladder there, this remarkable pump that's very elastic. It can get to this very large capacity if needed. And then you see the outlets. There's 2 parts here. So the pump is the bladder, then you have your outlet. The first part of that outlet is the prostate, okay? Again, the focus of our talk. The prostate is a separate organ, but it encircles the urethra. So the urethra is the channel that goes all the way from the bladder out the end of the penis, It's what carries urine into the toilet when you pee. So the urethra, the first part of it's called the prostatic urethra. That's the prostate. It has both sexual and urinary function. So we're going to focus really on the urinary function of the prostate today. But you can see just in this graph on the left is the normal size prostate. It's about the size of a walnut. So I tell patients, a healthy, normal 20, 30-year-old man has a prostate about the size of a walnut. As you get older, in most men, that gets bigger. And it can get as big as a coconut. And that's a little bit of an exaggeration, but not really. We see patients who have really big prostates. Okay, so something to pay attention to when you have symptoms as you age. It could be from an enlarging prostate. So we're going to pop up a little quiz here. So this is more of an audience participation. So BPH symptoms. So when patients walk into my clinic, I always hand them this survey. Okay, I'll bring it up a little closer, but you're going to be able to click. If you click on that quiz, I want you to do this with me. Okay, so what this survey is, it's called the International Prostate Symptom Score. It's a standardized questionnaire. It's what we use to track our patients' symptoms over time and also their response to treatment. So let's just go through a couple of these. And if you're listening and if you're having these symptoms, come and see us. So incomplete emptying, not emptying your bladder well. Frequency, I'm peeing a lot. I'm going every 2 hours or even less than that. Intermittency, okay? So I kind of have an intermittent stream. Urge, gotta go. I'm on the highway. I'm pulling off of this next exit because I can't hold it any longer. So severe urgency, weak stream, straining. I'm pushing to pee. That is not normal. We don't want that for our patients. And then waking up at night. Okay, so nocturia is a really common problem, and it's actually really debilitating for patients because it disrupts your sleep. When you have bad sleep, the rest of your day won't go well. And if it's because of your prostate and your bladder, again, there are great treatments for this. Okay. Now, the second part of this questionnaire at the bottom, which again, if you've already filled it out, you're going to get a score. It goes 0 to 5. Again, not at all or almost always, but the second part is one thing I really care about, which is if you spent the rest of your life in this condition, peeing the way you are, how would you feel about it? I'd be delighted. Doc, I'm peeing great. No problems at all. Okay. Well, that's good. Or I would be unhappy or terribly unhappy. This is not how I want to live the rest of my life. So that quality of life score is really important for me and for as I'm working with a patient to talk them through the next treatment steps. Okay. And then are you interested in treatment? Okay. So most men, when they have high symptom scores, if you're in this 20 to 35 total score, that means you have very severe symptoms. Most of those men are interested in treatment. So we'll jump to the next slide now. So what are the complications? Okay, so why is this important? You may have these symptoms, but maybe they don't bother you that much. Well, complications of BPH include urinary tract infections. That can be a very serious problem. It actually really affects the elderly, and they may not be able to even communicate, oh, I'm burning. They show up with confusion. It's a very common problem. So it's a very serious issue. Bladder stones. So people think about kidney stones. That's a big problem in the United States. Has to do with our diet, how much we drink, not drinking enough. But you can actually form a stone in your bladder as well. So the bladder doesn't empty fully. Okay, that's a big surgery actually that patients have to go through to remove those bladder stones. Kidney failure. A lot of you listening may have a family member or a friend on dialysis. It's a really difficult thing to go through. And if you're backed up and your urine's not emptying well, your bladder's not emptying well, you can actually damage your kidneys. Leakage, incontinence, this is extremely embarrassing. And actually, sometimes I have to ask and really push patients and say, tell me what's going on. Are you leaking at all? And they're ashamed and afraid to even tell me that they're leaking into a pad or on their underwear, or they had to go leave a restaurant. And this is a big problem for a lot of patients and really affects their quality of life and what they can do, and can sometimes lead to social isolation. So do not ignore that symptom and do not avoid seeing the doctor if you have incontinence issues, leakage. And then bladder damage. We don't have time to go into this and see a picture of it necessarily, but I look in patients' bladders every week, and sometimes you see just from the stretching, again, if you are waiting to watch that Joe Burrow touchdown I mentioned earlier, but you live in that state 24/7 where your bladder's totally stretched, you're going to damage your bladder. It's not going to work as well. And you may end up with a catheter. So a catheter is a little tube that goes into the penis, and some men have to wear this all the time or put catheters in and out. Or other catheter strategies because the bladder doesn't work at all. We don't want you to end up in that situation. And there are ways, by listening to your symptoms, paying attention to them, and coming in for an exam with your primary care doctor or the urologist, that you can avoid that. Now, this says BPH does not increase your cancer risk. That is true, but I always do these talks hand in hand. Prostate cancer, get your prostate cancer screening. I say all men between the ages of 50 and 70 should get screened for prostate cancer. We do that routinely as part of this evaluation. And there are some high-risk men, Black or African-American men, those with a family history, you need to come in even earlier, 40 to 45. So it doesn't increase your risk of cancer, but you also have to go through prostate cancer screening as part of this evaluation. All right, let's jump ahead. Okay, so little lighter side. So my father loves the far side, and this is just a great card that I give to people. So urology department, can you hold? Okay, little joke to break up the the talk. All right, so how is this diagnosed? Okay, couple things. You're going to see a cartoon about this later, but digital rectal exam. So we feel the prostate, okay? And some guys are afraid to come in just because of that. They may have had a buddy who told them about it. I'm not going in. I'm not going to the doctor. He's not going to feel my prostate. It's a rectal exam. It's really not that big of a deal. It really isn't. And I tell patients this because it's very important for us to know the size, the shape, and also we can diagnose prostate cancer with this exam. A blood test, this is what I mentioned just before about the importance of prostate cancer screening. We do this in all men who are presenting with urinary symptoms who have BPH to rule that out. The urine, we look at blood in the urine. That can be important for stones and other things. Also infection, we make sure that you're not presenting with an infection. We would treat that with appropriate antibiotics. And a bladder scan. So this is a little prop time, okay? So what is a bladder scan? So it looks just like this. So I'm going to turn this on. So I show you this because this is not, and I'll move the camera down a little bit so you can see, but this is nothing scary at all. So I'm actually going to I'm going to try to do a live bladder scan on myself. We'll see if I've emptied completely. So you can see here, when you come into the clinic, it's this little ultrasound probe, okay? A little bit of jelly on your lower belly, just below your belly button. And what we have you do, if you're having these urinary symptoms, we want to know, do you empty your bladder? So we do this little ultrasound test, non-invasive, doesn't hurt. I'm going to do it right now. So kind of put it on your lower belly here. And then you're going to look at the bladder and it's going to give us a volume. Okay. So mine says 0. I pee well, which is good. Now, a lot of times patients will come in and that bladder scan will show 500 and they may need a catheter. But even if it's just slightly elevated, that could show signs that your bladder is weakening over time or that you have some degree of obstruction from your prostate. So other tests, there's some more, we won't show you these, but there's different tests that really assess the bladder's flow and the bladder's pressure. I'm not going to go into details here, but for some patients, we're really trying to make a decision about what to do next, either managing medications or even surgeries, which we'll talk about soon. We'll do more testing. Now, the UroCuff test is great. We do that here in the office. It's very quick. It's also non-invasive. Okay, you basically pee in. It's shown here. But you pee in this funnel that's right next to this machine. We measure the stream, and then we interrupt the stream with a little pneumatic device that tells you what the pressure is without having to place a catheter in the penis. So it's non-invasive, it's quick, and it gives me and it gives the patient really valuable information about where their bladder is and what kind of risks they have going forward if we need to be more aggressive with our treatments. Okay, this one is a little more invasive. This graphic may startle some of you guys, but what I'll show you is this is really important. And it actually can be done with sedation. Okay, this is called cystoscopy. This is one of the most common tests that we do. I've done thousands of these in my career, and we basically use a local numbing jelly if you're awake, which you can do. Most men tolerate this actually quite well awake. A local numbing jelly, and we look at the prostate. So we're looking at all that anatomy I reviewed before. I'm looking at it with a scope and a camera. It's a very small scope. It's smaller than some catheters actually. And we're directing it in a non-invasive way through the urinary tract, looking at the prostate, looking at the bladder. And what I'm looking at is how big is the prostate? What is its size and shape? Those are key characteristics, okay? You'll see that later in one of the treatment algorithms we use is the size and shape influence our treatment recommendations, okay? We're also looking at the bladder again for stones, for signs of infection, for signs of damage. And there's also scar tissue that can develop as part of the urinary tract. So it's a very valuable test. And a lot of times we'll recommend this as part of your evaluation. And it's nothing to be afraid of. Again, we offer sedation to patients. If you are nervous about this, I do that to a lot of patients, a light sedation. It's not a full anesthesia, but also it can be done comfortably with some local numbing jelly. Now, other tests. So we do an ultrasound. This is, again, like the digital rectal exam, a probe. We measure the size and shape. This is very valuable also to identify concerning lesions of the prostate. And then sometimes men will get a biopsy. Now, this is, again, that same, you can see how the prostate cancer discussion is coming into this discussion a lot. And the reason for that is because as we screen men, sometimes we do find concerns, based on your risk factors, based on your PSA level. And we'll do these evaluations at the same time. We'll look at the bladder, look at the prostate, but also do a biopsy to make sure that you don't have prostate cancer. Now, this can be also done awake with some numbing agent, but also can be done with an anesthesia, and men have a good experience with that. It's a pretty non-invasive test, nothing that, we counsel our patients about the risks of this, as we do with all these procedures we're going to talk about. But this can be done very quickly, very safely, with a very low risk of bleeding and infection. All right, so the next, okay, we're going to pop up, I think, another resource for you guys. Okay, so when you come into our office, every man who comes into my office, who I'm having this discussion with, I give them one of these, okay? And you have a little link there. You can click on that. You can download that. We'll also send it out afterwards, so you can look at this resource. It's, basically a lot of what I'm talking about today, but it gives you important tips on lifestyle changes that can affect your urinary symptoms. So if you scored very high on that quiz earlier, what can you do now, today, to help your urinary symptoms? There are a lot of things, okay? We'll go through the medications, avoiding some that can cause urinary symptoms and taking some that can help them, and then procedures at the end. But I want to focus here on lifestyle changes, okay? So this is a really big thing. I mentioned, again, the title of the talk, men's health, okay? So it's an umbrella term. We're talking about more than just the prostate, okay? What you can do with your lifestyle has a tremendous impact on how well you can pee, how well you can empty your bladder. So what does this involve? So here's some voiding techniques. Avoiding excessive liquids after dinner so you don't wake up in the middle of the night, avoiding bladder irritants, excessive amounts of caffeine. So I probably drink too much caffeine in the morning to get me going, but alcohol, spicy foods, they're different things that patients, and I always say trial and error. You can try some things and see if it helps, take some things away out of your diet and what you drink. But this is just the tip of the iceberg on lifestyle changes. So patients ask, well, what should I eat? I start with the basics, okay? So all patients, every patient should exercise. How much? Well, there's different recommendations based on that. It depends on your other comorbidities and medical issues and orthopedic issues. But I start with walking. I say you got to exercise, get your heart rate up. Some form of resistance training is critical, all aimed at ultimately weight loss. If you're overweight, most of us in the United States are overweight, and that affects your urinary tract for certain. So weight loss, nutrition is key, avoiding highly processed foods. What diet should I do for the urinary tract? Well, there's a lot of discussion about that. I simplify it saying the best studied of all these diets is probably the Mediterranean diet, and it has tremendous benefit for a variety of health conditions. So basically what that is good fruits, good vegetables, avoiding all the junk that we consume. So when you eat highly processed foods, junk foods, and same thing with the beverages, you're going to affect your urinary tract. And by taking those out, which is very difficult to do because these foods are addictive, these drinks are addictive, if you really work on that, build those habits, you're going to pee a lot better, okay? So weight loss is one, exercise, nutrition, sleep is critical. So we don't get enough sleep in the United States, and there's a lot of sleep hygiene measures that you can take into account, cold, dark room, avoiding, staring at your phone at the end of the night. I talk about sleep with patients because it does affect how much you wake up. The quality of your sleep will affect how much you wake up and pee at night. And there's another really important thing, a little bit of a sidetrack here, because I emphasize it to all my patients: obstructive sleep apnea, okay? It's not really a lifestyle change. It's a different medical issue. But if you have untreated sleep apnea, so sometimes I'll turn to the partner in the room and say, does he snore at night? And, oh, yeah. So get a sleep study. If untreated sleep apnea, oh yeah, we're reconnecting. There we go. Sorry about that. A little streaming connection issue. So we were talking about sleep apnea. So if untreated sleep apnea is a big deal, okay, and it can affect your urination. So see your PCP, get a sleep study. All of these things affect how well you pee, okay? Now, medications. There are some on this list. Again, we'll send this information out. It's in this booklet that I just referenced, okay? So some medications, if you're taking regularly, you can see common ones, Benadryl, and patients ask me all the time, supplements, hey doc, I saw this ad, prostate health, bladder health, should I take it? So the answer is, well, I don't know. I don't know what's in it. A lot of these over-the-counter supplements are unregulated by the FDA, so we don't know the quality of what's in there. There are some herbal supplements. I'm open-minded to look at anything and review the data on it, but In general, I try to have my patients avoid those if possible, with some exceptions. So be careful of what you get over the counter or from the TV, because there's a lot of side effects and regulatory problems and quality problems with those medications, okay? So what do we use, okay? This is the mainstay of BPH treatment, okay? So there's 2 classes of medicines: alpha blockers, okay? They relax the bladder, the prostate, okay? And then 5 alpha reductase inhibitors. That's a mouthful. What those do is they shrink the prostate. Now, one thing I want to say is these medications work great, and they actually work great in combination too. There's a very famous trial called the MTOPS trial that was run by my former chairman down at Vanderbilt. And what that study showed was if you use one or the other or both, like patients who use both of these medicines actually did better. Now, moving forward though, from that study, we found that a lot of patients, just get prescribed these medicines, but their symptoms worsen, which is true. There's a group that don't respond well. And there's also side effects. There's actually significant sexual side effects to both of these. One, the first category of medicine has something called retrograde ejaculation. So for young men who have urinary symptoms and that may really bother them. And some actually get scared by that. So actually it's not going to hurt you. It's not a big deal. But there are side effects to these medicines: dizziness, lightheadedness, alpha blockers, okay? There's alpha receptors in more than just the prostate. And so this medicine for elderly patients who are on walkers or who have recent surgery, orthopedic surgery, it can cause falls. If you're dizzy and lightheaded on the medicine, you can fall. So it's a big deal. So I really screen patients for that and say, if you experience any symptoms, you got to stop the medicine right away, okay? So these medicines are great. And again, we count, that's what we do. When you sit down with me, we go through your individual symptoms. We make these recommendations. I prescribe these medicines all the time. They work great, but we have to go through the side effect profile of each. That's very important, okay? Now, lighter side, another joke. This is for fear. This is just break up the talk a little bit again with another joke. So men are unfortunately unfortunately, very resistant, and some of them don't even come in because they're worried about their prostate checks. So don't worry about it, guys. It's not that big of a deal. It's a very important thing for your health. All right, so procedures, okay? So we talked sort of in order of what I do, to start is lifestyle changes, modifications, medicines as an option. And sometimes patients do all those things, they do them well, or they have side effects from the medicines and they're like, I need something else, okay? So my symptoms are very difficult. My quality of life is very poor from my urinary symptoms. What else is there for me, okay? The answer is there are a lot of things. And actually, this is an area that is exploding with new technologies, okay? Even since I finished my training in residency, there are procedures that have come out that didn't exist when I was in training. Now, we'll go through these. And there's a note about insurance. Our process, we have a very good team that goes through all that. When you go through our evaluation, our workup, all the tests that I mentioned, we're going to be recommending treatments that we really strongly believe are medically indicated, surgically indicated to avoid those complications. Remember the complications? We don't want patients with a catheter, for the rest of their life. We don't want patients getting infections or bladder stones or kidney damage. So we recommend treatments a lot of times to obviously improve quality of life, but to avoid those devastating consequences, okay? Now, this slide is busy, and you may not get a zoom in on it to really see, but I want to show you this because this is actually the most recent AUA guidelines. So the AUA is the American Urologic Association. We basically take our best researchers, we look at thousands of papers, literally. You go through all this evidence on medical therapy, on surgical therapy. A team of experts grades this, and they come out with recommendations. And this is a very simplified version of a much longer guideline. But the reason I want to show you this is how we talk you through these options. And if you look so let's just focus on surgery on the right. So the right side of this is the surgical management. You see lots of acronyms. We're going to go through some of these. So there are 10 plus different treatments for the prostate. Some for small prostates. I mentioned size and shape. That's really important. I mentioned that to my patients. I'm like, you have a large prostate or a small prostate, or the shape of it is concerning. You have something called a median lobe that may be obstructing. Therefore, I recommend this procedure. This guideline helps us go through that, but it breaks patients into 3 simple categories: small prostates, less than 30 grams, and large, 30 to 80, and then very, very large. Okay, there's different surgical procedures. And you'll see as we go through some of these, we're not going to go through all of them. We don't have time for that tonight, but we provide this information to patients so they can make an informed decision if they're at a point where they need a procedure to pick the best one for them, okay? Now, UroLift. Okay, so I do a lot of these. This procedure is great. It's minimally invasive, but it's not for all patients. Okay. So I always tell patients, so some people come to me and say, well, doc, I want this. I say, well, maybe not. Maybe that's not the best treatment for you because of this reason. A median lobe would be a good, if you have a real big median lobe or a really, really big prostate, the trial for this procedure showed that it was outside the bounds of that trial. So there's really big prostates, which we'll talk about in a second. But this works for a lot of men. And what does it do? Okay, so you can see the picture here. There's the prostate. It takes these tiny little sutures, these little implants that we deliver with a device with a scope. Okay, there's no cutting. This surgery doesn't involve cutting through the belly, like removing your gallbladder or your appendix. It's done through a scope through the penis, like the cystoscopy. Okay, we put little pins, and what it does is it opens up the top part of the prostatic urethra, and these implants, they stay in there. They can be removed, but they compress, pinch. I kind of talk about it almost as a pinching of the prostate, and it stays open. Kind of scars open in a good way. Now the prostate isn't cut, none of the tissue is removed. And an important part about this is it can be done in almost all cases outpatient, same day surgery. You come in, get the procedure done. And a lot of patients can have this done without a catheter. That's really, I had a guy today, I was just seeing, and he wanted this procedure. We talked about all the different options, and he's like, well, whatever you do, doc, don't put a catheter in me. I said, well, I can't guarantee that. Sometimes there are reasons to put a catheter in. There's a little bit of bleeding from the procedure, but a lot of patients can have this done very quickly, very easily. Now, the story with this procedure is it works very well, and it has data out to 5 years. We continue to study it and use this, but for, again, larger prostates and there's some questions about long-term durability, since it is a newer treatment, it may not be the best option. But for a lot of men looking for a less invasive procedure that has really good urinary outcomes, doesn't involve cutting or catheters, a same day procedure, it's a great option. Next one is a couple things here. I mentioned this already. Pretty straightforward recovery, but I tell patients, and this is very true. So this is not a perfect procedure because the first couple of days can be kind of rough. You have a lot of burning, urgency, a little bit of blood. So I say patients, you're going to hate me for a couple of days, and then hopefully as you recover from this, you're going to love me because you're going to be peeing a lot better. Okay. But here's just, again, summary of how this works again. So TURP. Okay. So TURP is next. TURP is the transurethral resection. I have a lot of patients who refer to it as the rotor procedure. This procedure is really, really effective. Okay. It is a little more invasive. We're removing the tissue. Okay. So you can kind of see in the picture up here, a prostate tissue being resected. Okay. So you're removing obstructive tissue. Okay. And part of that is to open the urinary channel. And eventually, once you heal that surface, that normal line of the urinary tract heals back over, you're going to have a really good long-term result. So it's been around a long time. I do it regularly. Patients do great with it, but it does involve a catheter. Sometimes involves a hospital stay for a lot of patients. So a little bit more invasive, but very durable, excellent. Does have some sexual side effects. Again, all these things, I'm not going to go into every detail of every surgery tonight. I just want to give you a high-level overview, but all these options can be great options for an individual patient. Next, okay, we'll jump through this because I want to get to that one's GreenLight. GreenLight is similar to TURP, but instead of using a little electrode, a little loop to resect and remove the tissue like you saw in that graph, it uses a laser and it ablates it. I do this one fairly regularly as well, and I focus it on my patients who are at high risk for bleeding. So a lot of patients have cardiac conditions, they're on blood thinners, high risk for bleeding. This has a lower bleeding risk in general. So this one can be done for a lot of patients, again, same day, because it has that lower bleeding risk. Patients can do very well and get discharged home on the same day. So a great option for certain patients, okay? Again, not going to go through all of the details. This is summarized very well in that handout. But again, another great option for patients, particularly those who are on blood thinners, okay? All right, hang in there. We're almost done. Okay, so I'm gonna leave time for questions. Somebody already jumped the gun and put a question there. So let me just go through there. Hang in there. We're almost done. Okay, Aquablation. This is a newer treatment. Okay, this uses, again, all these technologies have their pluses and minuses, but this one uses steam, basically these water jets to ablate the prostate. It's image guided, so it helps the surgeon who's doing this, but it does require an overnight stay, has a slightly higher risk of bleeding. We've got a robust experience here at the urology group, and happy to talk about this treatment with you. But another option, this one's really good actually for larger prostates. So if you have a really big prostate, rather than doing the UroLift, this may be a good option for you. Okay, so Aquablation. Here's the machine, but let's jump to that. Okay, HoLEP. HoLEP, I've done a lot of these in residency. Now I have a partner, Dr. Duzing, who does a lot of these here in our practice. But this is a great surgery for patients who have enlarged, very, very big prostates also. The best way to think of it, and you'll see in your booklet, and maybe on the next slide here, is think of an orange. Okay, so the orange, the peel. So if we just keep the peel intact and take out all the fruit on the inside, that's what the HoLEP does. Okay, so it uses a holmium laser to enucleate, to take out the inner core of the prostate. This is not removing the whole prostate like prostate cancer surgery. That removes the whole prostate, whole different thing. This is done through a scope, same thing. Most of these are done through the scope. And what we do is we take the edge of the tissue and move it up, kind of push it out of the way with the laser, and take it just to that outer orange peel. Okay, and it gets a great result. The obstruction is basically removed. A little bit longer recovery, but patients have great long-term outcomes from this procedure. Okay, there's the orange. So there's the orange analogy. I think that's really great, and it explains this well. Again, another good option for men with big prostates. Now, robot. So I do this one for same thing, big prostates. So some men prefer this approach. Now, this is a little bit more invasive because it does involve little incisions. It's an transabdominal surgery. But again, for patients who have a really big median lobe, this tissue that's growing inside the bladder, or who also have a stone in the bladder, this can be a good option to remove a large stone, to remove a large median lobe and prostate. It does involve a hospital stay overnight. This is done robotically, so a little bit more invasive, but it also requires a longer catheter. So we have to let the bladder heal because you make a small incision in the bladder, but a great option for men with big prostates, and the outcomes from this are really good as well. So we have a lot of good options. Here's a picture of the robot. So that's what it looks like actually when you're doing the surgery. It's one of the reasons I went into urology is robotic surgery. So again, a great option for men with big prostates. And you can see, I keep saying that we have a lot of great options. You weigh the side effects, you weigh the risks, you weigh the long-term outcomes of all these when you're making your decision. Okay, and my job is to help walk you through that process. Okay. All right, last slide here. So this I took this actually this morning in the parking lot. So I don't know if you'll let you guys look at it for a second because I didn't get it at first. Like, what is it? This is actually my dear partner, Dr. Dan Robertshaw. This is his license plate. So no PP, see me. Okay, so I thought this was very clever. So I think he came up with this. But we're happy to see you. If you have any issues with your urination, questions about prostate cancer screening, any of the things that struck a chord with you, and if your symptom score, and this I mentioned this for you, if your symptom score, it was really high, if you're 20 to 35, or even if you're 8 to 19, even if you're mild, we're happy to talk to you, to see you, to examine you, to go through that. There's a little link that popped up here, requesting an appointment. We are happy to offer this for you. Okay, so this is if you are interested in an appointment with me, you can click on this link and it'll take you right there. But I actually want to pivot while you guys are doing that. I'm going to pivot to some questions. Okay, now let's do this in order. Okay, so if you have questions, you can submit them. Hopefully, you can see that in your little dialogue. But here's what I'm going to go through. Okay, so I'll tell you, I may not be able to answer all of them, and I may defer some of these. And I'll tell you, like some of these discussions, again, they're highly individualized. So I'm going to try to generalize them for the whole audience, but I appreciate you guys asking questions, okay? And you can see our contact information there too. So if you didn't click on the appointment link, you can see I have offices here, and that's where I am right now at our Norwood Surgery Center. And we also have a Fairfield office, but you can go to our website, see me, see any of our doctors. We're happy to help you with any of these issues. So, all right, to the questions. Okay, I think I have some blockage. I'm going to keep these all private. So if you message me, I'll keep it. I won't mention anybody's name. But the first question is, I think I have some blockage and to empty my bladder from an enlarged prostate. Yeah, if you think that, come see us. Okay, because a lot of patients, and you'll see, actually kind of joke, we should put our little card above the urinals in every restaurant in Cincinnati. Have you been here for more than 30 seconds? Like this gentleman who asked this question, do you think you have blockage and you're having trouble emptying your bladder, please call, please make an appointment. We can help you. We want to help you. We want to improve your quality of life. So if you're sitting at that urinal at the restaurant or again, going back to the Bengals football game, and you've been there for 30 seconds and you're straining and you're really uncomfortable, that's not normal. So you got to come and see a urologist if you have that. All right. So we're going to jump to the next question. Next question is, please describe. Oh, okay. This is a great question about sexual side effects. Okay. Please describe choices that have the least potential sexual side effects. Okay. Now, what do you mean by that? Well, I'll tell you what I mean by that. I think of erectile dysfunction, a very common issue. We didn't talk about that tonight, and we've done webinars on this before. It's, we talk about all men's, like I mentioned, the title is men's health. So we address ED as well as prostate cancer screening, but sexual side effects are really important to men. Okay. And I understand that. And so when I think of sexual side effects, just to kind of put it very simply, I think about, erections, erectile dysfunction, and ejaculatory function. Okay. So those are two different things. Ability to orgasm. There's a lot that goes into this. I'll tell you that the minimally invasive surgical treatments, okay, and there are many. UroLift, Resume, iTend is a newer one. It's like a stent that's temporary. It goes into the prostate. Really, really interesting technology that I've used for some patients who are interested in preserving sexual function, ejaculatory function, not having ED, and not having ejaculatory dysfunction. Aquablation has a favorable side effect profile from a sexual standpoint. So again, these are things we go over individually with each procedure. Some of the procedures like a TURP, and you look at these other ones that are great. And again, I recommend them strongly for a lot of men. One of the things is, as you look at these studies, you're following men over time. And one of the natural consequences of aging is erectile dysfunction. Okay, that's a normal thing that happens. Your erections are not as good as they were when you were 18 years old. Okay, I call that normal male aging. Now, ED is a medical condition. We can help it, and we can do particularly things on the lifestyle modification side to help you with that. But as you age, as you recover from some of these surgeries, your ED may get worse. And so it's hard to know exactly if it's from the surgery or just a natural part of aging. But yeah, I mean, one of the reasons that some of these procedures are so popular is because they have less sexual side effects. Okay, so when you hear missed or minimally invasive surgical treatments, a lot of those have less sexual side effects. Now, HoLEP. Okay, here's a question about HoLEP. I'm going to go through as many of these as I can. So HoLEP, will HoLEP work for a moderate-sized prostate? Yes. Why would a doctor advise a TURP instead of a HoLEP with a moderate prostate? These are really good questions. Okay, so yes, HoLEP can be used on smaller glands, and HoLEP again has excellent outcomes. I did a lot of these in residencies, but I don't do them as much anymore. One of my partners really specializes in this, but HoLEP is a great option, and it can be used on smaller prostates. And one of the reasons we recommend TURPs, it just depends on patients, the surgeon's level of comfort with that procedure. It's a very technically challenging procedure. It takes a little longer, and it involves a hospital stay in a lot of cases. Now, again, if you're interested in this technology, we have a great surgeon who does these, and so I'd be happy to set you up with him. But it's a great option. A TURP is a great option. Again, patients make individual choices, but that's a really, really, really good question, actually. So yeah, you can do a HoLEP on a smaller gland as well. Now, is the age of the patient or the size of the prostate more? Let me say that again. Is the age of the patient or the size of the prostate more important in procedure choice? I would say both. That's a cop-out, I guess, but both of these things are critical. So age of the patient. So, we can offer most of these procedures to any patient. I've done surgeries on patients in their 90s who had really debilitating urinary conditions, but we were able to offer a safe, less invasive option to them, and they were able to pee better afterwards. So age is a huge factor in how we counsel patients on risk, but I wouldn't say that one procedure is necessarily better than another unless you have high risk factors for more invasive surgery. So age, again, does come into play when we choose less invasive options. But a lot of my younger men who could undergo a robotic surgery, they want the less invasive options because of the sexual side effects. So prostate size is critically. So I would say, if I really had to pick one, prostate size, and the reason is because you saw that I showed you that guideline, that algorithm. It's broken down by less than 30, 30 to 80, and then greater than 80. So that really does influence where the evidence is, where the studies have shown the best outcomes for patients. So if you have a really, really big prostate, again, some of these minimally invasive procedures won't be as good. If you have a really, really small prostate, you may prefer, and it may be better for you to have a less invasive procedure. So MRI, okay, this is a great question coming up. So you guys are asking good questions. I like this. So MRI of the prostate, can it be helpful? Yes. Now, MRI of the prostate is actually not something that we routinely do. And I actually think that an ultrasound, a digital rectal exam and an ultrasound of the prostate are sufficient. A lot of our patients, for BPH procedures, to make that decision. And MRI is not mandatory. It can be helpful, though. And a lot of patients will have MRIs for prostate cancer evaluations, or will have a CT scan for they had appendicitis or a gallbladder issue, and they got a CT scan. We can measure the prostate from that, actually. And so imaging can be very helpful. But the sort of the bread and butter workup that we do is that scope test and the ultrasound test to measure the size and shape of the prostate. MRIs of the prostate, again, come into play more with prostate cancer screening, okay? Evaluation, diagnosis, and screening, particularly men who are on surveillance. So that's a whole different discussion, but can be helpful. But most men who come in just for BPH evaluation treatment don't get an MRI. All right, how many of these procedures are covered under insurance? That is, well, the answer to that is with the appropriate workup that's guideline concordant, supported by the evidence. Most of these procedures are covered. A lot of times we go through, peer-to-peer conversations if there's an issue. These with insurance companies, we have a really good team that handles that. I'm frankly pretty separate from that, but there's not a lot of cases where I've done an appropriate medical workup that won't be covered by insurance. Everybody's insurance plan is different. Again, that's not something I have the bandwidth. We have a great team that does that for us, and they'll help walk you through that to understand that. But these procedures are generally covered by insurance, but a lot of it depends on your individual plan and what that involves. Okay, so would a truss for volume, so this is a transrectal ultrasound, and a biopsy be necessary? Okay, so why I think this might be why would, I might be misreading it, but so why would a prostate volume and a bladder biopsy be necessary? Okay, well, the bladder biopsy is a little different question. So if you have blood in your urine, or you have a lesion in your bladder, or you have a tumor in your bladder, we're going to biopsy that or remove it. So that's kind of a different thing. We don't routinely biopsy the bladder. The ultrasound helps us better quantify exactly the shape. So sometimes it's hard. I mean, I've done a lot of these, but sometimes it's hard to get the exact volume of the prostate with a digital rectal exam. So that's why we supplement and routinely do, and it's recommended in the guidelines for patients to get another form of volume assessment besides just the digital rectal exam and scope. And so the ultrasound helps put you in one of those categories: small, medium, large, and then it helps us influence your treatment decision and recommendations, okay? So that's why we do it routinely for most men undergoing a BPH evaluation. Okay, complicated medical history. A TURP has been recommended, but I want to avoid at all cost incontinence. This is a really... what procedure is best to maintain the integrity of both sphincters? Okay, this is maybe a medical person or someone who's really been doing some reading. So this is a great question. Okay, so one of the side effects and one of the risks, and I would say one of the risks of really a lot of these procedures is urinary incontinence. Okay, leakage of urine afterwards. There's a lot that happen. Can sphincter damage? That's what this question is. Can damage to the urinary sphincter be a part of that? Yes, and we're very careful though. When we do these procedures, we use anatomic landmarks. If you really want to know the details, this person's very detail oriented. The viramontanum is a little ridge in the prostate, and we use that as a landmark to ensure that we're not treating the prostate beyond a certain point to damage the sphincter. Okay, so we have these anatomic landmarks that help guide us to avoid damage. It rarely happens, but it does. And a lot of men will experience some intermittent leakage of urine right after. We got to think about this as you'll have such a high pressure bladder that's been under strain and stress for so long that you sort of open up the outlet and just everything comes out. There's a lot of bladder instability, so there's some bladder retraining that has to happen during your recovery period. So sometimes the leakage is short term, okay, but these procedures do have that risk, and so a TURP again is a great recommendation. Generally minimal risk of leakage, but there are other procedures that I would say have less of a risk of having that happen. Okay, and again, very individual anatomy, examination, medical history that goes into that. But yeah, there are other treatments that may have. If that's your most important, and I've had patients who ask this exact question: whatever I can do, doc, I want to avoid this. Well, then we'll tailor your treatment. towards that side effect. Okay. Now, another question. So prostate cancer. Okay. So a gentleman in the audience is being treated for prostate cancer. And it just shows you how common this is. 1 in 8 men. Again, important to come in and get screened. I'll say it again because I'm so passionate about it. Men between the ages of 50 and 70 get PSA screening, digital rectal exam screening, higher risk groups, Black men, family even earlier, 40 to 45. So we tell patients, again, come and get your prostate checked. So this gentleman is being treated for with radiation for prostate cancer. He also has a large prostate. He also has severe symptoms. Again, so these are all complicated questions, and you have to really look at the patient's full medical history and physical exam and evaluation to make the best decision. But the answer is yes, you can undergo concurrent BPH treatments, and you can go in the setting of radiation, treat after radiation prostate issues successfully. So there's a lot of different, and there's a different approach for that patient, obviously, based on the prostate cancer. But yeah, that's something I would not ignore for that gentleman. If you're experiencing severe symptoms, we can do things both medically and even with some of these less invasive procedures to try to help you during that period. Okay. Now, here we go. I've been prescribed Cialis for my prostate, and now my insurance refuses to pay for it. Okay. All right. This is we unfortunately see this. So Cialis is so tadalafil is the generic name. Cialis is the medication. Okay. So this actually, it wasn't listed. Again, I can't go through every little detail during this talk, but this is used for BPH symptoms and actually works great. And I'm sure the patient who wrote this said, hey, it was working great. And then, so it is a very costly medication. But what I would say to that patient is the good news about Cialis, or now tadalafil, is it's generic. So you can actually shop around for and talk to your urologist and see if there is you can get prescribed the generic version. And in some cases, you can find very cheap options for daily Cialis, okay, or daily tadalafil. So I would try that, maybe an out-of-pocket expense. But are there other drugs that can do this similarly? Yes. Again, I mentioned some of those: the tamsulosin alpha blockers, the finasteride, and there's other medicines. It depends on what your symptoms are, but I would definitely get an appointment. Look at the generics. Okay, so the generics for Cialis are much lower cost than they used to be. So it may be something you could do out of pocket if your insurance won't pay for it. All right. Can anything have urinary flow restriction besides prostate enlargement? Yes. And that's part of that scope test you saw. Some of you may have cringed again when you saw that, but we're looking for urethral strictures. Okay. So there can be scar tissue in any part of the urinary tract from a prior infection, a prior catheter. There's a lot radiation treatment. We just heard the gentleman share about his radiation treatment. So that can cause scar tissue. So yes. There are other things that can restrict the flow, and we always look for those. Those are things that we evaluate for, okay? And there's also flow restriction that has to do with the pump. Remember the bladder, okay? Some patients have neurologic conditions, so prior history of a stroke, Parkinson's disease. These things can cause the bladder nerves to be weaker, and the bladder doesn't squeeze as well. So you get the same thing. It's not a blockage, but it's just the bladder not squeezing well, okay? So is a cystoscopy, next question is a cystoscopy always necessary? Well, so my opinion is yes, and there are some physicians who may sort of concurrently do scopes and procedures, but in general, I would say yes. If you're considering a surgical treatment, I always recommend it as a preoperative evaluation. Why? Because sometimes the anatomy outside of an ultrasound or a CT scan can surprise us, and we don't want surprises on the day of surgery. And actually, that cystoscopy test influences what treatment you'll get. Okay. And there's a lot of anatomic considerations that go into that. So I do think it is. And most urologists do that as part of their workup. Okay. So we talked about the exam, the blood test, the urine test, the flow test, cystoscopy before a surgical decision is made, is something that I do with basically every patient. All right. One more question here. Is an elevated PSA reading most often indicative of prostate cancer? Okay. That's a complicated question. I'll keep it short, which is because I did this literally 3 times this afternoon. Okay. So I had patients who asked this exact same question. I have an elevated PSA, doc. Does this mean I have prostate cancer? And the answer is maybe. We're going to evaluate you with a very thorough process, repeat blood work. There's other blood tests that you can do, MRI imaging. But when you have a PSA, that's to find out if you have prostate cancer, but ultimately that can only be determined by a prostate biopsy, okay, with our tools today. So other things that can cause an elevated PSA, okay, urinary retention, okay? So if you're not emptying your bladder, if you hold a ton of urine in your bladder, that can cause recent catheters. So a guy comes in, and we see this, unfortunately, guys whose bladders are sort of at that end stage. They've ignored symptoms. They've really stressed their bladder over a long period of time. They end up with a catheter, and we wouldn't check necessarily PSA at that time because recent instrumentation, recent infection, urinary retention. There are other causes, and then just the prostate being enlarged, okay? So if your prostate's really big, your PSA will likely be higher. So that's a really good question. But PSAs, again, when they're high, we always evaluate patients through a very systematic process to make sure there's not prostate cancer, and then we go from there. All right. So this is I got a very specific question. I'm happy to answer it, but this may not be, I'll try to make it also relevant to the audience, which is, I just had a procedure. I just had this GreenLight procedure. So we had a gentleman who that was what he chose to do. Should I continue my medicine after this procedure? So he's taking tadalafil. We just mentioned this. So I would, first of all, that specific question, definitely call your doctor, whoever did your surgery. If it's me, I don't know if it was my patient, but what I would say is I usually continue medicines all the way through the recovery period because we want you to recover, and then we take them off because you're still in the healing process, especially 6 days after these procedures. You have what I describe almost as a scab on the surface of the prostate. Okay, so you're still healing. So I don't like changing a lot of things at once. Some doctors will stop medicines almost right away, but that's an individual discussion you should have with your individual doctor. So if there's any other questions, you can put them in there, but otherwise I need to wrap this up here in just a second. Again, to summarize, I really appreciate your time. This men's health topic on urinary symptoms and BPH, it's really critically important. If you have symptoms, let your primary care doctor know. If you have had a recent catheterization or are straining or have an infection, do not delay seeking care. These are really, really important things to see a urologist. We have lots. You saw just, again, the tip of the iceberg of what we can do from a lifestyle modification standpoint, from a medication standpoint, and from a procedure standpoint. So we really encourage you to come in and see us. I'm happy to see anyone on this call. You'll have that information at the end. But yeah, appreciate your time. Thank you so much for this opportunity to share this important topic with you. All right, you guys have a great night.